Hello, this is Dr. Martina, your online sex therapist and sex educator. Tongues and lips are the most sensitive receptors of stimuli from the outside. So why do a lot of couples don't have any oral sex? Why do I hear things, I know we hardly ever do it, I don't like it, I don't like the way he does it, he says I don't like the way she does it. And they do that without communicating that at all. They just don't have oral sex. And that is just a sad affair. So I decided to put this video together, and this video is from the vagina's perspective, and next week I'm going to do one from the penis perspective. So if you have a vagina, if you're the owner of a vagina and you would like to experience oral sex, then watch this guide that I put together for optimal oral sex. If you are a man or woman who loves to give oral sex to other women, then of course you can watch and learn also. So here we go. If you're a woman, you might say, why is she addressing me with this learning process? Why can't you just teach my lover how to give me best oral sex and just tell him that or tell her that? Well, I could do one of those 10 best ways to give oral sex that make her scream your name. But then my question is, who's that really for? And whose responsibility is it that the body is being sexually satisfied? Well, it is yours. You can learn to figure out what you like. You can learn to communicate that with your partner. And then you can practice that communication. You can practice that learning, and you will be able to be in charge with your sexual satisfaction. And you will not have to say, well, I don't like the way he does it, because you can teach them how to do it with your body, because one size does not fit all. So this is how you do it. Both of you benefit from this show and tell exercise. The receiver, the woman, she gets to show her private parts and drop some of the inhibitions that go along with that, because the more we practice it, the better we get at it. She will be able to, if she knows, to tell him what feels good. If she doesn't know, she will learn how, she will find out what feels good, and then she will also increase her communication skills. And the talking has to happen between the giver and the receiver, and all of that is positive stuff. This is really, really good stuff. So before you start the show and tell, if you have any concerns about the smell of the vagina, or if you're worried about not being clean or whatever, just take care of that. Come prepared and take care of that, so you don't have to deal with any negative thoughts in your mind, because we definitely don't need that. And then I suggest that you lay on a flat surface. Bed is the best. And put a pillow under your hips, under your pelvic area, which will lift the pelvic, which will give your lover a better view. And then you can start the process. Now, before you tell him to go and look, or her, make sure that you tell him to be gentle, because the mucous membrane of our genital areas is very subjected to damage. So it has to be gentle. The nails have to be short. All of that goes without saying, so just make sure that your partner is gentle while they're going on the exploration. So the first thing your lover will encounter as he goes or she goes down on you is, obviously not this, will be your genitals, but here I have a little cute little model to show it better. And the first thing they will encounter is the Labia Majora. Big lips, it's also called, or the outer lips. I use the word outer lips because it's easier to identify where they are. They have some fatty tissue area right here, so they're not as sensitive, and they're actually homologous to the scrotum. So what you can then ask them to do is to kind of pull on them a little bit and open it up and expose the nice pink inside of the lips. And that's where they will find the inner lips, labia minora, or the small lips. Now, they may be a little hard, they're very in size, so they may be a little hard to find. So make sure, you just have to remember that to tell them that they're exclusively part of the outer lips. So they just have to kind of pull on it, and they will be able to find it. Now, you may also want to instruct them to use a finger and touch them, so you know that they found them, and you can tell them, yes, that's what they are. or they can tell you if you don't know. Now the only thing, if you're past menopause, make sure to use some spit, because it can get, if it's dry hair, that cannot feel that good. You can also ask them to put the finger in, see what that feels like on your body, and only like, to 2 inches, because that's where most of the nerve endings are in the vagina. And that way, if they kind of push up a little bit, then what they find is the urethra sponge, which is right above the opening of the vagina, and that sponge has a small little hole, and that's where we pee out of. A lot of people don't know that either. They think we're peeing out of the vagina, but we don't. We're peeing out of that urethra sponge right there. So now it's the clitoris. So this model here has a nice big hood. Sometimes the hood's a little smaller, and you may be able to, when the lover goes down, they see maybe a tiny little thing peeking out here. And what you can do is to be very gently pulling back the hood, just like you do with an uncircumcised man, but even more gently, because the clitoris has 8,000 nerve endings. The sizes vary, but the amount of nerve endings does not. So there's 8,000 nerve endings, and they're ready to give you pleasure, and if you're not aroused, then that may hurt with direct contact. So no direct contact, because we're still just looking. So that is the showing part. Now we're going to get to the tell part. Have your lover take the same path. As he or she goes down, have him start with the outer lips. What they can do is they can grab the lips with their lips and start pulling on them with the mouth, because now the fingers are going on the side a little bit, and now it's time for the mouth, which is the lips and the tongue, the whole thing, not just the tip of the tongue, but the lips and the tongue are doing their job, are doing what they're here to do. So you can do that. You can ask them to maybe open it up with the hands, but then come in with the tongue inside here and see how that feels. And then pay attention to the pressure. If the pressure is really good, ask them to stay with that pressure. If you need to have it changed, go to lighter pressure. If the rhythm is too fast, ask them to go to lighter, to go slower, or if it's too slow, ask them to go faster. Pressure and rhythm are your indicators of what you want them to do. Then you can tell them a little up or a little down, a little faster, a little slower. They need direction. So, and that's only can come from you. Now, if the clitoris is ready to be stimulated and you feel like it's ready, maybe direct contact is good right now with the tongue. And if it's too much, if it gets too sensitive, then you just kind of say, whoa, whoa, and you just stop for a second, take a deep breath. Let it all go as much as you can, and then maybe start with stimulating the clitoris through the hood. Have them grab the clit with the hood, with the protecting hood in between them with their lips, and just kind of like suck and pull on it a little bit, and that can go a long way. You can definitely get blood flow into the clitoris, which makes her then less sensitive, and then she can be exposed and be ready for some more stimulation. Now, if you're only getting the tongue, some lovers are shy. They think sex is not messy. Sex is messy. Oral sex is messy. I mean, can you suck on a pit of a mango without it being messy? This is the same thing, because you want to use your whole mouth. If you're only getting the tip of the tongue, it can be irritating. If you want the whole mouth and you can feel the breath and the warmth of the mouth, it's much better. So make sure you pay attention to that too, what feels good and what doesn't feel good. Now remember, you are a teacher as much as a student. You're teaching your partner by telling him what feels good, what doesn't feel good, and you're a student by being aware what feels good and what doesn't feel good, and then make the adjustments. This is practice. It's fun practice, and you will get better at this. Not the first time. You will get a little uncomfortable, but you will get better with it if you practice and just keep doing it this way. Now, if you belong to some of the women who have a very high muscle tension, this whole system runs on a very high muscle tension, then they may have a hard time, and you may have a hard time even enduring any kind of a stimulation orally. Please check out this video that I did a couple weeks ago, and it may help you further. And if you need any further information or help, please give me a call and get in contact with me, and I will be there for you. Next week we're going to do the oral guide for the penis, from the penis perspective. And I will talk to you then. Have fun practicing.